What about blood type? I'm sure every one of us has a blood type that's different from one another,
Mhm.
and then these placentas are taken from moms who have a certain blood type.
Right.
Is that a characteristic flaw?
No. No. You're not getting any genetic material, you're not getting any blood types in there. Nothing like that. And there's, like I say, there's never been a case of rejection. There's tens of thousands of these that have been done across the United States. So where does this come from? It comes from the placenta. So in the placenta, there's the amniotic side, which is the mama side, or the baby side. And there's the chorionic side, which is the mama's side. Okay? And so the baby side is immune privileged, meaning it actually doesn't have an immune system. Otherwise, if it had an immune system, mama's immune system would reject the baby as a foreign object. Okay? But the mama's chorion side actually does have an immune system to it. But there are no cells in our amniotic allografts that are collected from the chorionic side. This is very important because there are companies, and anytime there's a new science that's out, there's going to be some companies that take shortcuts with this. And they include the chorionic side. Unfortunately, they have to process it further with chemicals to break that immune system down of mama's side so that there wouldn't be a rejection when it's injected into us. Unfortunately, it depletes about 85% of the stem cells. So it's not as functional as just the amniotic allograft, right? So again, baby side, amnion side is immune privileged, no chance of rejection. And research goes back actually 100 years where they used membranes, placental membranes, to heal ulcerated and burn victims. I mean, this isn't like brand new science, but what's new about the science is how we collect the material and how we can actually get it to be really effective in what it's supposed to do. That's what's new. So here, this comes from the Journal of Cell Science, because every time I lecture, people go, well, what's the science on this? Well, let me just say this. All you need to go on and do is Google PubMed.com, PubMed.com. It's got all of these different articles on all different kinds of health issues. And search for amniotic allograft. You're going to find hundreds of papers on this, right? This is well-documented research. So the article goes on to say, amniotic stem cells have been used to generate heart valves, trachea, muscles, fat, bone, nerves, liver, cartilage tissue. Amniotic fluid contains more stem cells than there are in adult bone marrow. Right? So when we draw bone marrow out, we're getting old stem cells, not as many. When you inject stem cells into the knee with degenerating cartilage, a portion of these stem cells will attach to the damaged area and begin to grow new healthy cartilage cells, supporting and healing previously untreatable injuries. Amniotic stem cells show potential for healing soft tissue injuries such as those involved in tendons and ligaments, and cartilage and structural damage. Amniotic stem cells are able to locate areas, and in doing so would be able to differentiate into those type of cells that are involved in order to start the healing process of tissue that typically cannot be healed without regenerative medicine. So degenerative joint disease is the body's inability to repair itself. This stuff just goes in and begins to stimulate that process. So the in-office procedure, 15 minutes, no anesthesia, no hospital stays, no antibiotics, 0 recovery time. You get injected, you get up, you walk out the door. It's really that simple. We just don't have people doing high-intensity impact activities for a couple of weeks afterwards. We want to give the stem cells time to regenerate. We just did a bilateral hip on Friday, both hips, and pretty severe degeneration in there. And the gentleman emailed back today saying that he's able to walk better and has less pain. His gait mechanics are already improved. And Dr. Dixon and I were talking about that. His body really hasn't had time to regenerate anything. It's the anti-inflammatory and the high hyaluronic acid that's in there cushioning that and just making it feel good. Now the real game starts for him in the regenerative capacity. Plus he's going to follow up with us with rehabilitation techniques. So do you think it would be important to rehabilitate after you have this procedure? I think it's really important.
So what is the longest patient you have?
The oldest?
Yeah, the long after treatment.
I'm the oldest patient we have.
For how long?
3 months. January 13th of this year.
2 months?
January 13th of this year.
How long
So,
does it last? A year?
how long,
What's the longest?
how long?
pain-
how long will it last?
Yeah, that,
It depends. So, my regeneration is continuing, right? And I expect it to continue until next January, at least. Maybe it'll continue longer. Maybe it'll be a little bit shorter. But if I were to stop with the results that I've got right now, I'm happy as can be.
How long have you guys been doing this, maybe is what he's saying, like, how long?
I'm the first
You're
patient,
the first one. Okay.
January 13th of this year. But we're associated with clinics, about 300 clinics across the United States that have been doing it for about 5 years. Right, and some of them are okay, some of them are not okay. Yeah, bone marrow, again, so again, you know, I've talked about the bone marrow and the pros and cons. Does bone marrow help? Sure. In my opinion, not. Plus it's very invasive. You have to go under anesthesia. You got to have the, you know, and so there can be problems associated with that. Plus, I don't think we're going to, you know, again, if I put 67-year-old stem cells in my body, how much regeneration am I going to get out of it?
You need the premium stuff.
Yeah, I want the high octane stuff.
The young stuff.
Medicine.
What, dear?
Is this what we call non-traditional medicine?
This would be called breakthrough medicine.
It's called no insurance cover.
No, I know because
Yeah.
the cancer treatment places are like private pay and stuff. So
Yeah, yeah.
I was just wondering if it's like that.
Well, insurance doesn't cover it, if that's what
Okay.
you're asking.
Okay, yeah.
Yeah, no, insurance, this is an investment you have to make in yourself. Yes.
How often and how many shots, injections do you have to have?
Generally just one.
Oh, really?
Generally just one.
If I have a problem with my knee and my hip, do I need two?
Yes. Yep, absolutely. And so we've done multiple joint injections in people with, again, excellent results. Pardon me?
Each one is a separate cost.
Yeah, and we, you know, we'll get into that in just a little bit.
are you saying if I have a shot today, I will never need one the rest of my
No, I'm not going to make that guarantee. So let me just finish off. Let me finish up with the presentation if I could. All right, because I want to come to a conclusion here for you. And then I'm going to be around to answer all your questions, and I'll stay as long as it takes. Otherwise, we won't get to the end here. And I want to present an opportunity for you that I think you might appreciate. So rehabilitation. We use chiropractic, computerized range of motion, core strengthening exercise, flexibility, trigger point therapy, myofascial therapy. We re-educate gait mechanics, postural assessment, anything that's necessary to regenerate and rehabilitate. So here's a 43-year-old lady with debilitating knee pain, no history of trauma. Over a course of 2 years, the knee pain worsened to a point of not being able to climb stairs sideways. She had to climb stairs sideways and get out of a car without almost collapsing in pain. She had to stop all exercise for 6 months due to the pain. She had ligament tears noted in the knee joint. She got injected. 1 week after, she was able to run up and down stairs with minimal pain. 4 weeks later, the patient describes as 80% better, could squat with almost no pain. And the end of 2 months describes herself as 95% better, able to return to exercise, pain-free running, squatting, and lifting. Who would think that would be good results? Yeah, absolutely. And this is the kind of results that we expect. We can't make guarantees. One of our consultants is an orthopedist down in Texas. He's about this big with his cowboy hat on, and he talks with this Texas drawl. And I said to him, Dr. Bjork, what do you tell people when they've got a really degenerative joint and they're asking for what your opinion is of the success? He says, well, Dr. Cooper, he says, I tell them their chances of success are between 0 and 100%. And they're probably going to fall somewhere in between. And that's the truth. We can't predict this. All I can say is that the success that we're getting and the other 300 clinics that we're associated with across the United States are getting are nothing less than phenomenal. So here's Colleen, 54-year-old physical therapist with debilitating bilateral knee. She had a condition that caused her knees to dislocate more than 20 times in her life. She was told that she was going to have arthroscopic surgery at age 22. She was told she was going to have her knees replaced at 40 or 50. She did rehab, she did nutrition, she did glucosamine and chondroitin sulfate, she did chiropractic, she did HA injections. For the past 30 years, she couldn't sit crisscross, wear high heels for more than a couple hours, run at all, difficulty going up and down stairs, and could not do a full squat. Anybody have difficulty going up and down stairs? I remember those days. So the day of injection, 1 week after, mild inflammation in her knee. She had a little bit of inflammation. Now, Barbara, who you saw the video on, she had a little bit of inflammation a couple days after the injection. My inflammation went away. Other people's inflammation goes away. It's all different. But the inflammation is so mild, it's nothing. It's just the amniotic allograft is going to work and cleaning things up. 4 weeks after, she was able to wear heels for a 2-day conference, able to do a full squat and get a case of water out of the bottom of a shopping cart. 5 weeks later, 95% better, started running, pain-free squatting. She says it's strange not having anything bother my knees. And I know Colleen, she was not one of our patients. She is associated with one of the 300 clinics across the United States. So here's Colleen's x-rays. And see, I'll speak up a little louder. See what this joint looks like? See how these are open? See how this one is beginning to be so-called bone on bone? Okay. You see about 9 months later how this is beginning to open up here? Right? That's why she's feeling better. Things are regenerating in there. She's got some synovial fluid in there. She's got some cushion. She's got some bounce in her step. It's one of the things I told Dr. Dixon after he did my injection. And by the way, he's a master at it. We went to Denver in January, on January 13th, and had Dr. Dixon inject me in front of a number of doctors from all across the United States. And they literally gave him an applause afterwards. He did both my knees and my left shoulder. It all took maybe 20 minutes at the most.
How much that cost you?
The cost of the allografts. I had to pay for it. Yeah. So here's patient LS. And look at, do you see how the knee is buckling in there? Yeah, that hurts. That's very painful. A few months later, you can see how the space is beginning to open up there. And there's not quite as much buckle in there. Barb, Barb, the other lady that did the video, we had to brace both of her knees. She was knock-kneed. Now her knees are straightening out. She mentioned how her hand is straightening out. Her knees are also straightening out. But she had to have braces to help that process and rehabilitation.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease?
So there's advantages to taking a proactive approach to this process. And I know a lot of you are concerned about costs. But costs become significant when you have to have surgery. No question about it. And so, plus the pain, plus the complications, saves you time, quality of time especially with friends and family and grandchildren and things like that. People want to be active in their older years. People want mobility. They want to maintain their independence. And if your wheels aren't working, if your joints aren't working, it's hard to take care of yourself. And it's not a lot of fun. Here's the truth of the matter. The longer you wait, the more degeneration occurs. The sooner you have the procedure, the sooner you start to regenerate and repair. So, what are your decision options? One is do nothing. That's a decision. Physical therapy. Who's had physical therapy? Yeah, physical therapy is good. You know, it's a good deal.